presenting a case of 65-year-old male patient with gradually progressive dysphagia, initially for solid, then liquid. Having history of coughing and choking when drinking water, there is no history of fever, weight loss, hemoptysis, or voice change. There is no history of neurological weakness, but mild stiffness is there. There is no significant past history of any trauma. Patient having past history of long-standing cervical spondylosis, there is no history of tuberculosis, diabetes, or any neuromuscular disease. On 90-degree telescopy, there is swelling over the posterior part of the posterior pharyngeal wall, covering the posterior part of the vocal fold, and there is pooling of the secretion in the piriform sinus. X-ray cervical span showing large anterior osteophytes at C5 and C6 level projecting forward. Barium solo demonstrates extensive compression over posterior pharyngeal wall and cervical esophagus. CT scan neck showing confirmed size and exact location of the osteophytes. It also excludes other causes of masses. So, diagnosis is cervical spondylosis with large osteophytes causing dysphagia and risk of aspiration. Management include conservative like soft diet, posture training, swallowing therapy, and analgesia. Surgical treatment, if there is severe dysphagia or aspiration is there, then you go for anterior cervical osteophytectomy, or rarely there is sometime required stabilization of spine also. So key points are age usually more than 55 years. Male are most commonly involved. Most common site is between the C5 and C6, followed by C6 and C7. Symptoms are dysphagia, aspiration, cough, neck stiffness. Complications include aspiration pneumonia, weight loss. Investigation of choice is CT neck with barium solo, and treatment conservative and surgery. Transoral or transpharyngeal approach to these lesions certainly risk the swallowing problem. So best approach for these lesions are right-sided anterolateral cervical approach, or Smith-Robinson approach is the ideal approach for these type of lesion to prevent the aspiration and swallowing complication.